Practitioners of bioidentical hormone restoration therapy, BHRT, generally favor topical, that is through the skin, forms of hormone therapy because the real human sex steroid hormones are so easily absorbed right through the skin, and once absorbed, the hormones circulate freely and they function very well in the body. But despite the obvious advantage of topical hormone therapy, every once in a while there's a patient who seems unable to absorb hormones through the skin. They either won't experience the expected symptom relief, or they will increase their dose multiple times in an effort to gain relief. And then upon laboratory testing, we sometimes even see that the circulating level of whatever hormone it is much lower than what we expected. The culprit might be the skin itself. More often than not, in these disappearing hormone cases, the patient is also being treated for hypothyroidism, low thyroid function. Untreated or undertreated hypothyroidism can have profound effects upon the skin thickness, the skin texture, and the skin barrier functions. Even in cases where the thyroid hormones have been titrated to restore full function, I still sometimes see dermal malabsorption. The skin is just not quite working right. Well, the answer is simple. Just switch from skin cream to sublingual or under the tongue troches or drops. The dosage is the same as what you would give topically or through the skin because the route of administration, medically speaking, it's essentially the same through the mucus or through the skin. It goes direct to the bloodstream. If the patient has already doubled or tripled their prescribed dose, then you'll be able to ramp back down to the human physiologic dose, because now the hormone is getting into the bloodstream and it's going to work just fine. Yes, I see a few downsides to using sublingual troches or drops instead of topical creams. One is that some patients actually chew and swallow their troches instead of allowing them to slowly dissolve inside the mouth. And in that case, you've got medication entering the body by what we call the oral route of administration, that is through the stomach and the liver, which creates more metabolites and more strain on the liver. Another problem is for follow-up testing. When you're using sublingual under the tongue drops or troches, it's difficult to get the timing correct when you collect saliva because the saliva becomes so saturated with each dose of hormones. So in those cases, follow-up testing should be done with the finger stick, the blood spot, dried blood spot, instead of saliva. Serum testing, mainstream laboratory serum testing, will be inaccurate because exogenous hormones, that is supplemental hormones that come from outside the body, simply don't show up very well in serum until after the point where the person is actually rather overdosed. I still feel much more comfortable prescribing topical or through the skin bioidentical hormones and then adjusting the dose as needed, but it's nice to have an alternative for the occasional case of the mysterious disappearing hormones.